I had some language problems. Like the very last thing before the seizure was that I couldn't read the menu, and that had happened a few times for a few months. I'd gone to see a doctor, and just a general physician, and she asked about my sports playing, and I minimized it to her because I'd been minimizing it to me, but it was occurring. It would only last for a few seconds here or there. But 5 to 7 seconds where you're reading something you blank out, or 5 to 7 seconds where you disappear from the conversation is noticeable both to you and others. She offered to do a CAT scan just to see if I had a concussion, but I think because I minimized it and because I dismissed it, we put that off. But it was the exact same symptom as before. So we had to do some tests. We had to do an 8-hour neuropsychological evaluation. We had to do EKGs and EEGs and MRIs just to kind of see if there was anything else that it was connecting. Blood work. We were playing with anti-seizure medication because the first one I was on was apparently very old. It was effective, but it had a lot more side effect. And I was doing my personality from memory, if that makes any sense, because it just felt like it was taking so much out of you, you know. And I mean, I said, if the choice is between this and having seizures, I'll have seizures and be myself more. Probably the scariest one was this test called the WADA test, where they put parts of your brain to sleep to see what might be affected, you know. And when there's parts that I don't remember, I'm guessing from the memory center being to sleep, but when they put the language center to sleep, they were showing cards and these kind of things. And for however long that lasted, it was probably only a minute or two, I couldn't think in words. They were showing me cards and words they were saying, and it must be what it's like to be a small child or a pet. I was still conscious, but language wasn't even capable. I wasn't even capable of thinking, and that was probably the scariest moment for me, because that to me is what's being human, being able to have language and memory skills. And so if I had to pick between those and living longer, I'd like, well, I'll just die earlier. And my doctors were fairly evenly split on whether or not the risks were worth the surgery. They weren't on the same page, and they said, well, it's up to you. And I'm like, yeah, because I went to medical school. Thanks, guys. And so I told a bunch of my friends, we had this event at my house, and I told them kind of the way the tests had gone and kind of what the risks and rewards were, because the survival rate is higher if you do surgery. No matter what, with this particular tumor where it was at with me, which was pretty near the center of the left temporal lobe, it wasn't going to be able to be fully removed. So no matter what, I guess I wasn't going to be able to walk out without a brain cancer tumor. And so the risk reward, and my friends were almost exactly evenly split. And so it wasn't a clear decision for anybody, and including me. Finally, over one night over brownies and ice cream and some tears, I decided I'd do brain surgery, because I wanted to, at least, if I was going to die trying. And so I called the doctor up and said I'd like to do brain surgery. The original guy who did my biopsy, he actually says, I'm not good enough to do this surgery, which was crazy to me. You know, I'm like, and he referred me to a guy in Dallas. Some people talked to me about going to, some people in Houston. Ultimately, I went to Duke, and the guy who did my brain surgery is Dr. Friedman. He did like Senator Kennedy's, and he would take on higher risk surgeries than a lot of neurosurgeons did. And he wanted to do it. He's like, I'd like to do it sometime in the next couple of weeks. I'm like, well, I've got a marathon in a little over a month. Can we do it after that? So I was like, well, that increases the risk of that and this, but you may not have a marathon after the surgery, so we'll do it a couple of weeks after that. And, you know, the doctors gave me very realistic things, including him, and, you know, that it wasn't like I was going to walk out without a tumor, that I was going to walk out without cancer, that as things stood, you know, the 10-year survival rate was just barely over single digits. You know, obviously there was hope and that research would advance those kind of things, but that statistically speaking, as things stood, I was likely not going to make 40. I appreciated that honesty, but it was also pretty overwhelming, you know. And right before the surgery, they have you sign some waivers. One was to be part of a study, a long-term study, and it was optional, but I chose to be part of it because it was hard to find information about this because it's a rare brain tumor. And they also asked, you know, if something went wrong with the surgery, if I was willing to donate my brain to science. And I signed it and said yes. But I'm like, well, this is not why I hoped anybody would ever ask me to donate my brain to science. But so on both of those, you know, those were optional things. But I appreciated that because, I mean, I'm not a doctor, but you Google some things, and it was hard to find somebody else who had been through it. And so while I appreciated the medical approach, I also just wanted the human approach, because no matter how good those doctors were, they were just going from theory and from books. And there's something about having somebody who's walked the path before you as opposed to just studied it from the GPS maps that would help. And so so anyway, we had brain surgery, and it went as well as we could hope for. A friend got me a T-shirt. I walked out of the hospital wearing it. I gave him a piece of my mind. What I went into the hospital with was another friend gave me. It's not rocket surgery. And so, actually, in my neuropsychological stated, you know, humor is clearly a coping mechanism, and it was, and it is, and as coping mechanisms go, I'll take it. We all have to deal with our fears. We all have to express our hopes, and laughing along the way beat crying for me. I mean, both happen, but I preferred to laugh more often than cry whenever dealing with the stress, even of this. And some people think it wasn't taking it seriously, but I think it was a way to minimize the fear while dealing with it seriously, if that makes any sense.